Now, the World Health Organization has warned that progress in the fight against malaria appears to have stalled. In its annual report on this disease, the agency says the number of cases and deaths has remained largely unchanged in the past 2 years. In contrast, the dramatic falls seen since the turn of the century. African countries worst affected by malaria have struggled to make significant progress. This for over 4 years, since 2016. Now, to talk to us about the work that has been done in the fight against the disease, we're joined via Zoom by Director of African Applied Chemicals, Mthokozisi Sibanda. Sibanda, welcome to SA Today. Let's probably start there. The impact of possibly COVID-19 on malaria. We know that in particular the sub-Saharan part of the continent, Mozambique, South Africa, it is quite dire with a lot of people dying of malaria.
Yes, unfortunately, that's the situation. And what COVID has done is it has prevented governments in implementing malaria control programs. So we do expect malaria to get worse this coming season because, for example, spraying of insecticides in people's houses has not been done because of COVID restrictions. So malaria is a really dire disease that is affecting us in Sub-Saharan Africa.
I mean, I look in 2009, there were estimated 229 million cases of malaria worldwide. The estimated number of deaths around then in 2019, not 2000, rather 2019 rather, the estimated deaths were at 409,000. Mostly kids under the age of 5 are the most vulnerable. Where does one start? I mean, 67% of people in 2019. 67% of those people, that's a huge number of deaths in that age group.
Yes, I mean, it's a very scary statistic. 90% of all deaths due to malaria are in sub-Saharan Africa, and about 74% of those deaths are in children under the age of 5 years old. So, it's not only a disease that is affecting, Africa, but it's affecting the most important parts, that is young children who will need to play a role in the future in developing the African economy. So we really need to rise up, especially us as Africans, to solve these problems, to come in with innovative solutions, because largely right now we're, depending on, people from Europe and the Western world in general in coming with solutions for us. But I think the best people to solve this lingering problem is us as Africans coming with very strong innovations, because we're in it, we understand it better, and I think we stand a better chance of solving this problem.
Done because, 4 months ago, Africa was officially declared world polio free. What are the major challenges in the fight against malaria that we can pick up from that and do the same with this disease?
Well, the major challenge really with malaria is that mosquitoes have grown resistant to the insecticides that are used to control mosquitoes. Mosquitoes are very adaptable, very clever. They can change their physiology, for example, to resist the insecticides. They know that, houses either have insecticide-treated mosquito nets, or the walls of those houses are treated. And they know if they get into the house, the chances of dying are very high. So they've changed their behavior. Instead of biting people inside dwellings whilst they are asleep, they're biting people, late, early evening, before people go indoors, and also early morning when people wake up and go outdoors. So the real problem with malaria, one, is insecticide resistance that is grown rapidly, and the WHO is really struggling to have a response to insecticide resistance, because there are very few options available, few safe options available to the alternative insecticides that are available. And again, also the issue of outdoor malaria transmission or outdoor mosquito bites is growing as a major cause of malaria transmission. So we need to have very strong interventions to address outdoor mosquito bites, which lead to the malaria transmission.
Mthokozisi, I nearly had a laugh there, but it's obviously something not to laugh at. The fact that mosquitoes have, I don't say a mind of their own, but of course they have a mind of their own. The fact that they've attributed what they know happens within the household And being a holiday season coming up, most of us, well, those who want to be out there with COVID-19 will be heading to the beaches, will be heading to braais every evening, will be sitting with families, and that's when we could see a lot of infections of malaria, as you said, the outside gatherings of these mosquitoes.
Definitely, yes. I think outdoor malaria transmission is now the most significant mechanism in which malaria is transmitted. You know, when people go outdoors, particularly in the three main provinces, that's Limpopo, Mpumalanga, and KwaZulu-Natal, those provinces that border Mozambique, especially if you're going into the Kruger National Park, you really need to be aware that outdoor because mosquitoes that carry malaria, you know, they have a specific place where they bite people, and this is scientifically proven. They bite people 93% of the times on the ankles and feet. And those are the mosquito species that you find in Africa. So really people need to be aware of that. They need to protect their ankles and feet by having a suitable product. It should be your sock, or if you think it's too hot, you don't like sock, at least have an insect repellent band around your ankles to at least reduce the number of mosquito bites by malaria carrying mosquitoes. You do get mosquitoes that bite you all over your body. Those are nuisance mosquitoes. You know, other than nuisance, it's nothing much to worry about. But the ones to worry about are the ones that go for your ankles and knees. So you need to watch out, particularly if you're going into those three provinces, also areas that are closer to the Mozambican border, or even if you're going into sub-Saharan Africa, to understand the dangers of, you know, outdoor mosquito bites and protecting your ankles and feet from these mosquito bites.
Yeah, I've got a lot of nuisance mosquitoes at my house right now. I mean, my son last night, Daddy, come and spray my room. I'm sure every South African is going through that, especially the change of weather. Now, obviously, you mentioned that you've got repellents, ankle bracelets. What are the most common ones that work effectively? Because, again, it's easy to go into a Pick n Pay or a Checkers and say, I'm going to buy this repellent, whether it's Vaseline, whatever you want to call it, put it on, and I should be safe. You would possibly, obviously, advocate for something that would work, or most importantly, take your pills if you're going to sub-Saharan continent or countries, high-risk countries like you've mentioned, your Mozambiques.
Yes, definitely. I think in addition to taking prophylaxis, you also need to reduce the number of infective mosquito bites. Generally, insect repellents work. I think the major problem with most commercial insect repellents that are available, these are topical formulations, the ones that you apply on your skin. They last for a very short time. You know, they last for an hour or two. Then you need to reapply again, and then go on reapplying again. So that's the major issue. People don't have that discipline to say every 1 hour 30 minutes I'll apply an insect repellent. So what you need is a device or a clothing item that is already infused with an insect repellent formulation in such a manner that the formulation is slowly released over a long period of time. So it could be your socks or your bands. You need to buy such products that are infused with insect repellents so that you don't have to worry about applying insect repellent all the time. So I do recommend such products. Topical repellents can work well just before you go to sleep, apply all over your body and all that. But really, if you are going to spend prolonged periods outdoors, you really have to have clothing items that, are infused with the safe and effective insect repellent formulation.
Dr. Mthokozisi Sibanda, African Applied Chemicals Director. We could sit and talk about mosquitoes. There's so much I want to ask you, but we have to leave it there. I mean, the fact that you're saying that mosquitoes sat around and said, no, we don't go into houses anymore. They've got doom. They've got all these anti-repellents. Let's get them outside. There's obviously something that we as humans are overlooking, that animals or whether insects in this regard, they do think ahead of us. They do have brains. As far as we're concerned, you smack it, you kill it, and that's it. They actually do think about how a modem of attack or your way of attacking.
Yeah, I mean, mosquitoes are one of the most intelligent insects. If you speak to entomologists that work with these insects, they'll tell you how clever they are. That's why they have lasted for a long period of time. It's difficult to eradicate them because every time when you come with an insecticide, they change their behavior and adapt and survive. So they're survivalists, and really we need to think many steps ahead of them in order to defeat them.
Yeah, but we could just get along. Why can't we just get along? Maybe if they didn't have malaria, we just leave them as they were. Dr. Mthokozisi Sibanda, African Applied Chemicals Director, thank you indeed, sir, for joining us. Interesting conversation indeed, as I said. Thank you very much for speaking to us.